Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to talk about the congenital abnormalities to the fetus, which is there in the background, and then if we do have some exposure to some drug which we categorize as a category X. So if there is an overlap between these two things, so how do you differentiate and how do you identify, right? So meaning thereby that in the general the background, if we identify what is the risk to the fetus, so the risk to the fetus is this that 3 to 4%, मीनिंग देयर बाय दैट 100 में से 3 से 4 फीटसेस या बेबीज ऐसे हो सकते हैं जिनको कोई कंजेनाइटल एबनॉर्मलिटी हो सकती है एंड दिस इज व्हाट वी आर टॉकिंग अबाउट अ मेजर कंजेनाइटल एबनॉर्मलिटीज मीनिंग देयर बाय दैट वी बिलीव कि हमारी जो बॉडी है वो बहुत सारे सिस्टम से बनी हुई होती है दैट प्रोबब्ली यू कैन हैव अ कार्डियोवास्कुलर सिस्टम यू कैन हैव skeletal system you can have kidneys you can have the eyes ears and then you do have the heart you do have the gastrointestinal tract and then you do have the brain so meaning thereby इन सब चीजों का सामंजस्य बनाकर हम एक अपनी so these are different organs which come together and then they work all together in synchronous or in harmony and therefore the body functions एंड 100 में से 3 से 4 बेबीज ऐसे हो सकते हैं कि इनको किसी सिस्टम को लेकर कोई 3 to 4% मेजर कंजेनिटल एबनॉर्मलिटी हो मीनिंग देयर बाय दैट प्रोबब्ली वी माइट नीड सम करेक्टिव सर्जरीज टू बी डन ऑन टू दैट पर्टिकुलर ऑर्गन एंड ऑल दो स्टफ राइट ओके सो ये जनरल बैकग्राउंड रिस्क होती है now what we're talking about is a drug which we called as an category X called as an isotretinoin right so this is a vitamin A derivative usually being taken for sort of a resistant acne and अब इसके साथ issue ये होती है it is a lipophilic drug and that gets absorbed into our fat and has got a long sort of a half life so meaning thereby that ideally whenever somebody is taking this drug she should be the pregnancy should be deferred and pregnancy nahi honi chahiye and theoretically speaking the expectant mothers on this drug they should be given two contraceptives meaning thereby that if you do have a contraceptive failure to kam se kam second protection is there and therefore you don't conceive when you do have this exposure to this drug okay so let us not get into all those stuff so, what are the common or exclusive or pathognomic congenital abnormalities that can identify within isotretinoin is this कि facial asymmetry, midline facial defects, facial asymmetry, कान की कुछ खराबी होना जिसको माइक्रोशिया बोलते हैं and then we can have a cleft palate right not the lip exclusively but the palate then we can have a cardiovascular abnormalities which is exclusively for a conotruncal malformations meaning thereby कि जो दिल की जो outflow tracts होती हैं उनकी कुछ defect हो सकती है then probably we can have some limb defects and then we can have some defects with the fingers and then we can have some thymic hypoplasia so all these sort of in something around 7 to 8 congenital malformations which is very specific for this exposure to isotretinoin, right? So now let us talk about this this case, and then probably we'll talk about and then we'll decipher ki, how to go about it. Okay. So this is what we are doing is an anomaly scan at 19 weeks, and you see that we are having a right side cleft lip. राइट सो दी एल्वुलर प्रोसेस में एक डिफेक्ट है ये हम 4D में इसको एस्टेब्लिश कर पा रहे हैं सो यू सी दैट देयर इज अ डिफेक्ट ऑन द राइट साइड एंड दिस इज अ आइसोलेटेड राइट क्लेफ्ट लिप right and then this is the same 4D and this is the small clip and the video of it and therefore we can identify but probably what we are trying to delineate is this ki cleft palate nahi hai so lip mein hi defect hai which is an isolated one and then we try to look around for the nasal bones so both the nasal bones are being visualized we never have had any facial asymmetry and both the nasal bones, orbit, lens, macrophthalmia was not there. And then this is what we are seeing that there is no defect with the frontal bones. And there was no defect with the palate. Both the ears were being looked around and they were absolutely great. We never have had any issues with the heart. This is the second ear that we are seeing, right? And this is the list of the congenital abnormalities that probably we can have. Okay. Now, this lady had an exposure of an this isotretinoin, which is in category X, right, and which was overlapping with the last menstrual period. So, meaning thereby it was a very conceptual exposure of this isotretinoin, right? And then we are seeing this fetus at 20 weeks. So what we have tried to look around for is this, that we delineated, and then probably we try to look around for everything, starting from the fingers to the ears to the midline facial asymmetry, to cardiac to renal to limbs to thymus, as a matter of fact. Okay, so everything was great, everything was normal as far as the gestational age, what it should have been, apart from the very fact that probably we have had only right sided cleft lip, right? Now you see that the lip can also be a part of the normal abnormality. We really don't, it really doesn't classifies, or it we don't classify it to be a major sort of a congenital abnormality, as a matter of fact. Now there are two things which are overlapping to each other. One is this, that you have had that exposure of that particular drug which has been identified that there could create some troubles to the fetus, as a matter of fact, and then there is a baseline sort of a risk that would happen to every pregnancy, and every pregnancy has to pass on through that risk, right? And what we are identifying, what is the problem at hand is this, that we are having only a cleft lip. Okay, so CL is there but not the CP, meaning thereby that we don't have cleft palate, right? And meaning thereby those abnormalities which are very pathognomic to that particular drug of interest at the moment, like facial asymmetry, by some sort of an abnormalities with the ear, macrotia, we can have some issues with the thymus, we can have some issues with the limbs, we can have some issues with the heart, and all these things were not there. So meaning thereby then that it becomes a difficult call to take, right? So whether this sort of a condition has happened because of the drug, or because of the baseline sort of a my risk to have that cleft lip, right? So to decipher, or to identify, or to ascertain, or to say that it has happened because of this particular part and not because of the isotretinoin, or probably it has happened to because of that particular drug, it is very difficult. But all said and done, it is very, very reassuring. And we have had one case. In fact, she had come for fetal echo at 24 weeks, since the level 2 was not being done, since the anomaly scan was not being done at our place, and therefore we just wanted to be sure about the baby and all those stuff. And so probably we were just, apart from doing the echocardiography, we were just trying to look around for the baby and then delineating, and then probably one finding that stuck to us or to the fetus was there, that the left ear was not being visualized, right? Okay, so meaning thereby that probably whenever we are seeing the baby, it is not that sort of a difficult not to delineate those ears, that probably, so in one sweep probably we are able to see if the ear was a sort of an um, um, got pressed upon between the head and the uterus, but there were some issues regarding the left ear. And in the hindsight, we try to ask about that particular key. Did you have had this a drug that probably you were taking and all those stuff? She said, no, 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 we have absolutely clean and all those stuff. But then she was very pertinent about this thing, that she was using some cream. So we identified that it was an isotretinoin and all those stuff. So probably that ear abnormalities got stuck, and therefore, so meaning thereby that those are the basic things that are the first thing and the foremost, that probably that gets stuck to that particular drug of interest that we are talking about, right? Okay, so at the moment, now it is sort of an slightly difficult to, as far as the pregnancy is concerned, the decision is all sort of in social. So all the stakeholders, meaning thereby that they have to come together and they have to decide regarding what they want to do with this finding, as a matter of fact. But this is how it is, right? Okay, so many a times it is slightly perplexing, but the thing is this, that I want to press upon is this, that we do have a lot of good technology and the good machines available, and then probably we can try to look around for to the fetus in a very great detail, and therefore we can try to identify what exactly is happening to the baby and all this stuff, right? Thank you very much for your patient listening.